Perimeter Medical envisions a world where no patient has to be called back for a second surgery due to cancer left behind. Driven to transform cancer surgery, we are proud to introduce a new imaging technology using Optical Coherence Tomography, or OCT, which provides high-resolution imaging of microscopic tissues in real time. It equips surgeons to visualize margins in the OR with a clarity they've never seen before.
When I call a patient and tell her she has cancer, it's probably the worst phone call that she may receive regarding a cancer diagnosis. The second worst phone call is when I call her a week after surgery and tell her that the margins of resection are positive and that I have to go back in the operating room to re-excise yet another margin of tissue in order to try to get a negative margin so that she can do breast-conserving surgery. My name is Dr. Beth DuPree, and I'm a breast cancer surgeon. When we remove a lumpectomy, we have to wait for almost 5 to 7 days for a pathologist to tell us definitively that there's no cancer at the margin of our resection. For years, we've been asked by multiple different technology companies, what problems do we need to solve? And intraoperative margin assessment is one of the most pressing problems. Optical Coherence Tomography, which is the name of the technology that Perimeter has developed, is looking to become the answer to intraoperative margin assessment. When I scroll through images in the operating room, I've basically taken a lumpectomy, which is the cancer with a rim of normal tissue, and I position the specimen on the optical coherence tomography machine and look in 6 different planes to determine whether or not I can see evidence of disease. What I'm looking for are telltale signs of dilated ducts or interferences in the tissue in the image that's been created in order to identify if a margin appears to have cancer or ductal carcinoma in situ at its edge, so that I can take an additional shave margin at that time and then place that shave margin back onto the device to look at yet another area to determine whether or not my margins appear negative. What's amazing about this technology, although I only use it in the operating room for evaluation of breast specimens, this technology has the potential to be used in multiple other avenues of cancer care and surgical intervention in the future. So I feel really proud to be part of a game-changing technology for evaluations of specimens so that other doctors in other areas of cancer care, they'll be able to have the same gift that I have right now with the optical coherence tomography from Perimeter.